Welcome to ATCM, the emergency medicine channel. Today we are talking about antiretroviral therapy, how to initiate, what are the drugs which is available in India. Okay. Antiretroviral therapy means antiviral drugs to be started in a patient who is having HIV infection. Previously, HIV treatment was dependent on the CD4 count. When the CD4 count is dropping down less than 200, we have to start treatment. But the current guideline says whatever may be the CD4 count, we can start the treatment. Now we will see the common ARTs, antiretroviral therapies started for HIV patients. There are different classes. We will see what classes can be started initially. It does not depend on the CD4 count. Once you make a possible diagnosis of HIV infection by ELISA test, you can start the treatment for HIV, that is called as highly active antiretroviral therapy or HAART. If you see the classification, there are various classifications. One is NRTIs, second one is NNRTI, protease inhibitor, and integrase strand transfer inhibitors. NRTIs are nucleoside reverse transcriptase inhibitor. NNRTIs are non-nucleoside reverse transcriptase inhibitor. PI is protease inhibitor. INSTIs are integrase strand transfer inhibitors. We will see the drugs, common drugs in this group, and we will see what combination we can initiate. In NRTIs, there are multiple drugs: tenofovir, emtricitabine, abacavir, lamivudine, sidovudine, salcitabine, didenosine, stavudine. All these drugs are available in this group. Previously, stavudine and sidovudine, lamivudine was the commonly used drug, but nowadays the most commonly used drugs are tenofovir and emtricitabine or tenofovir lamivudine. Tenofovir 300 mg OD, emtricitabine 200 mg OD, lamivudine 150 mg BD or 300 mg OD is the usual dose. So these three drugs we should remember: tenofovir, emtricitabine, tenofovir, lamivudine. These are the combination normally given. Next group is NNRTIs. In that, previously nevirapine was the most commonly used drug because of its side effect. 30% Stevens-Johnson syndrome was there in nevirapine group. So nevirapine normal dose is 200 mg OD for first 1 to 14 days, then 200 mg BD. That was because of its side effect. Then efavirenz came, that is 600 mg, night time should be given after food. So efavirenz was the most commonly used drug in that group. Nevirapine was previously the drug of choice, but nowadays nobody uses nevirapine. Efavirenz is the most commonly used drug in this group, that is 600 mg night. There are a lot of drugs come under protease inhibitors. Atazanavir, indinavir, lopinavir, nelfinavir, sakinavir, darunavir. All these drugs are there, but ritonavir is the one drug which can be combined with other protease inhibitors to reduce the dose of this drug. Like you add atazanavir and ritonavir together in a patient, so you can reduce the dose of atazanavir. Lopinavir, ritonavir, so you can reduce the dose of lopinavir. Now INSTIs are newer drugs. We can see what are the drugs available in this group. Dolutegravir is the most commonly used drug in this group. 50 mg OD is the drug of choice. Raltegravir is available, eltegravir is available, bictegravir is available. So many drugs are available in this group. So we have four major groups: NRTIs, NNRTIs, protease inhibitor, and integrase strand transfer inhibitors. Now we will see what are the most commonly used ARTs nowadays. Most preferred regime all over the world is INSTI based regime. That is dolutegravir 50 mg OD, lamivudine plus tenofovir, or dolutegravir with abacavir with lamivudine. These are two regimens most commonly used. So, most preferred INSTI-based regime is dolutegravir, lamivudine, tenofovir. Single tablets are available in this group. Most preferred NNRTs are efavirenz plus lamivudine or emtricitabine plus cidovudine or tenofovir. So, these are the most preferred regime all around the world. Once you start ART, we have to always check the CD4 count. So, initially we will be checking the CD4 count. Every year we have to check the CD4 count. Normally, if your treatment is very good, CD4 increases by 100. Suppose now it is 200. After 1 year of starting ART, it has to become from 200 to 300. That is a normal response. Otherwise, you can go for viral load, HIV, RNA, PCR quantitative test. That should be undetected by 3 to 4 weeks. So, I am starting ART today for one patient today. After 3 weeks, if I check the viral load of this patient, it has to be undetected. So, we have talked about various treatment options in HIV patients. They are called as HAART, highly active antiretroviral therapy. Thank you.